Hello everyone, and welcome to this audio podcast. This audio podcast, as part of a Meteor edition. This audio podcast is part of a Biome bullet, and this audio podcast as part of a Lobostic Phantom, and this audio podcast as part of a Cyclone bonus, and this audio podcast as part of a Storm Robotics production. In this audio podcast, this audio podcast as part of this Meteor edition and this sort of Cyclone bonus. This podcast will look at a research poster presentation that was put forward for the UKKW in 2021. UKKW in 2021, and it's and a research poster presentation looking at excuse me, looking at a sort of a practice review, a practice review. It got linked to a sort of best practices in regard to empowerment and healthcare service, healthcare services education. So in this research poster presentation, a little bit of sort of in around the aims and objectives. This the research to inform additionally, the research poster presentation was collaborative between one academic institution and the social media platform, the Renal Patient Support Group, and to inform there have been in around this work, there has been peer reviewed and published works in a published form, and works are available through the RPSG through the RPSG platform. So around the aims then. So the work in this with the through this works, or this through this peer reviewed poster presentation from 2021, the the work sought to highlight if it is advantageous to involve multidisciplinary teams in online consultations and or educational sessions through, for example, the Renal Patient Support Group, the RPSG social media platform, to improve healthcare services and healthcare service provision, and also in line to aspects where there can be misinformation online through various ways, and thus to improve or to ensure to ensure or encourage, even encourage sort of the the sort of integrative integrated terminologies where healthcare literacy is concerned. So the review sought to understand, or the research poster presentation sought to prompt an understanding if it would be helpful to have follow-up online consultations with multidisciplinary teams for healthcare, or for healthcare following routine clinical appointments for and amongst healthcare service users. So a little bit of background. So tech has allowed healthcare service users with long-standing condition to access information relating to health and conditions of disease through a range of modalities, including the RPSG website. And the present concern, or one of the concerns, is that tech is that despite excuse me, despite tech advances, integration between information searching versus knowledge implementation is and can be somewhat challenging. Online information is and can be vast, but much of it can be daunting and lead to misinformation. And so the basics for healthcare service users with long-standing conditions with long-standing conditions, for example, still and can in amongst sort of the in amongst the usability in regard to the World Wide Web, for example, still require attention, and this has been pertinent. So support for healthcare service users with long-standing conditions from healthcare professionals at the same time can be multifaceted. Therefore, where healthcare service users would normally see more than one multidisciplinary team member for an aspect of healthcare service users would or may find it advantageous to schedule time with allied health professional who are who are trained who are trained to provide remote education service or services. And so, for example, healthcare service users might find it important to communicate and gain understanding of blood tests and investigations, and such initiative would be supplementary to healthcare and aligned to electronic patient records. So tech can improve healthcare service user documentation through more complete electronic patient records with fewer errors and improved ease and efficacy. Sorry, improved ease and efficiency. Providing documented education, thus what is discussed or highlighted through appointments or appointments, although some aspects of traditional consultations that take place through and between healthcare service user and healthcare service providers go and delve in and go sorry are entered into electronic patient records, the that are entered into electronic patient records, the providing or offering where there's offering of documented offered education as part of supplementary to clinical appointments, would and could allow more documented education, which would also reduce unnecessary complexity, and improve collaborations between not only between healthcare service providers amongst multidisciplinary teams, but also but also more critically, collaborations and 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 healthcare service provisions between healthcare service users and healthcare service providers through multidisciplinary team efforts. Telemedicine links, also for example, video consultations, imaging, and laboratory data could also enable laboratory teams to be involved in discussions with healthcare service users through for example group consultations, where group consultations, much like multidisciplinary teams on a traditional basis, would allow varying healthcare professionals from varying disciplines of specialties, in on a group consultation with a healthcare service user, based on particular scenarios. So, of course, any education provided would require documented and transfer of information, connectivity of any future or prospective tech or links between electronic patient records and the general data protection record 2000 from 2000 between 2018 and in more recent years, where the GDPR 2018 has been updated, and the present or current version being GDPR 2020 or 2022. Now, in regard to some bases around healthcare education as part of this research poster presentation. So, healthcare service user complications can stem from variety, complexity, and ultimately becoming where conditions can become multisystemic. And so, owing to particular long-standing conditions, healthcare service users also encounter various National Health Service or NHS services, such as again sort of laboratory investigations. And healthcare service users can also be prescribed various pharmacotherapy throughout condition pathway. So more and more healthcare service users are also prompted or encouraged to take a lead in and as part of what has been referred to the National Institute of Healthcare and Research at NIHR, for example, as patient and public involvement, or PPI. Little is known about a healthcare service users' understanding of result of of data or reports that are the outputs as part of and through electronic patient records, and only having access, for example, may not guarantee that healthcare service users know how to use the information. For example, healthcare service users also tend to want more face-to-face understanding, or at least have healthcare professionals be part of discussions where they can be more informed. By improving healthcare service users understanding and relating to those important laboratory tests and investigations, for example, this would also reduce inequity of care, and improve the health of and amongst healthcare service users. Healthcare support for healthcare service users with varying long-standing conditions from healthcare service providers, again, whilst can be multifaceted, again, educated or more informed healthcare service users become empowered and can make more informed decisions and choices. So now, in regard to electronic patient records. So EPRs, or electronic patient records access, has many advantages, but healthcare service user enthusiasm, at least retrospectively, has been variable according to literature, literature, and also even according to literature sort of generally, but also according to works published through the Royal College of Physicians, sort of retrospectively. The more successful systems have provided information that healthcare service users and healthcare service providers and healthcare and sort of carers, for example, may require, and usually in the setting of long-standing conditions, in emergency medicine, in amongst emergency medicine, in amongst emergent in and amongst also in emergency medicine. Variation in sort of use in sort of use has been regarded to various factors and have been expressed through where there has been expression in regard to in as part of report in various reports and in amongst literature where there can be there can be issues to the extent where it can prompt a digital divide, and at the same time, sort of where a cost in regard to utilization in healthcare, a cost in relation in regard to utilization and healthcare outcomes, in regard to healthcare outcomes. So whilst clinicians have reported that consultations with healthcare users has generally changed because of access to electronic patient records. Healthcare service users still have varying important questions surrounding sort of condition and disease sort of pathways, and in amongst sort of healthcare service users also tend to go through various stages of healthcare journey. One team informs of how effective it can be for healthcare professionals to use online spaces for education and multidisciplinary team involvement. Proactive allied healthcare professionals, or AHPs, tend to be also at the forefront in at least accessing evidence-based practices framework in around frameworks and surrounding multidisciplinary team, and in regard to some some bases in around the sort of underlying basis in regard to patient and public involvement efforts, and through data science and online and or remote and or sort of through remote working. So now, a little bit in regard to, as part of this research poster presentation, I look at sort of a structural and cultural isolation in context of healthcare. The clear hierarchy of occupations established through, for example, the growth of hospital medicine is attributed as a major contributor to commissioning and the dominance of medicine in the structural and the cultural isolation of healthcare workforce. International experience in planning care for healthcare service users with long-standing conditions also confirms different approaches need to be investigated. AHP, allied health professional patient public involvement at primary level, for example, still has not been stratified. The structural and cultural isolation by clinical care groups is focused on making small but marginal healthcare service changes for which the effort involved does not always appear proportionate to improvements in services with a focus on patient-reported outcome measures. Healthcare service users with long-standing conditions are not easily commodified within a purchaser provider market. The services are provided over months and years by a range of organisations and healthcare service providers, and it is hard as it is hard and challenging to split them into to split them sort of singularly. Um, Healthcare service provider specialists in amongst particular and specific specialisms can open electronic patient records, EPRs, and view important clinical data such as for example comorbidities, pharmacotherapy and communications communications between professionals between professionals and between professionals and between healthcare sectors. Reports of previous reports of imaging and any sort of chronological display of selecting and numerical data. At the same time, a decision then is made as to whether healthcare service users should go under further investigations and get investigations in context of primary care services, or referred to secondary care according to specific case scenarios. Now going into a little bit in regard to patient and public involvement. So questions that still require answering to some extent in and where PPI is. So number one, in the United Kingdom, our clinical clinicianing groups, clinical care groups, ready to support patients through technology and e-health, as been highlighted in some of the literature. Question two: is there a broader role for a broader sort of a role for multidisciplinary teams to be involved in education in education provision for healthcare service users. And so to facilitate best practices, steps should be put in place whereby strategies support healthcare service users to ascertain provision around sort of around particular diseases, particular conditions, and particular pathway and trajectories. This would also build sort of the healthcare service user, healthcare provider communication, ultimately prompting empowerment and informed shared decision making. Shared decision making is important for most healthcare service users. Healthcare service users want to be involved. There's also compelling evidence that healthcare service users who are active participants in amongst healthcare have better outcomes than healthcare service users who are sort of passive recipients of healthcare. The use of user-friendly and interactive healthcare services healthcare service provision is also important for knowledge and resource acquisition. Education, for example, would also help increase better healthcare service user outcomes. At the same time, now going into a little bit around some of the literature, a little bit more around the literature as part of this research poster presentation from 2021. So in excuse me, in a UK investigation, a qualitative investigation, 100 recipients from a randomized group are viewed online online or electronic patient records for the first time. Of the first 100, 65 of the of 65 of those were female, aged between 18 and 84 years of age, with a mean age of around 52, and 35 were male, aged between 19 and 81, the mean age of 56. Healthcare service users requested explanations around medical terminologies. Medical terminology is around 42%, abbreviations and acronyms around 13%, and information on tests and results around 17%. Many healthcare service users have concerns or tend to have concerns about receiving new information, for example, test investigations or results, or correspondence between healthcare professionals. They amongst this as part of this investigation, the participants were especially sort of concerned if the information contained abnormal results, or bad news. Again, this highlights again this as part of this as part of the investigation, informs that additionally informs where laboratory teams and specialists are required for understanding. So whilst healthcare service users use electronic patient records, like for example patient view, which is used nationally in amongst those who go through a particular sort of long-standing conditions, has been evaluated in several investigations. Healthcare service users healthcare service users continue to use PV, for example, over long durations. Over long durations, however, has data in amongst the literature has not been reported on a at longitudinal from a longitudinal research perspective. Clinicians or healthcare service providers also report that consultations with again, clinicians have reported, or healthcare service users have reported, that consultations have changed because of electronic patient records, and where there has been work in regard to different terminologies in amongst particular long-standing conditions to support and prompt understanding, and in works published in around 2016, some ongoing contentions surrounding different aspects of terminology had been highlighted in around and as part of a particular long-standing condition. At the same time, the aim in regard to aligned to electronic patient records or EPRs. Telemedicine again is usually described as is described as, for example, in amongst the literature, as telehealth, home care, or home based e-health. So the aim of telecare ultimately is to increase patients or healthcare service users' independence, quality of life, and to support healthcare service providers. But it can also prompt collaborative and team working between healthcare service users and healthcare providers. In some works published by uh, in some works published by a in and through a United States investigation from 2019, a team focused on looking at sort of the pre in regard to some of the pre-education aspects in amongst a particular long-standing condition, and where several modalities of interaction and dissemination for education were and was evaluated. The investigators included sort of face-to-face education and online sessions, and where the main endpoint was where healthcare service users would have the ability to select particular treatment modalities that would be right for them. Three assessment tools were utilized to compare not for example, number one, knowledge; number two, health literacy; and number three, in regard to quality of life. The investigation that took place over a 3-year duration, wherein 240 healthcare service users consented to get involved, and education or was found or had also been additionally identified was that education is required to support healthcare service users, especially in around and specifically around treatment pathways. The team highlighted that healthcare service users again want to be educated earlier, irrespective of face-to-face or online modalities. Similar works has also been carried out in works by authored in another in another publication in 2019, and works published in 2016. Therefore, sort of education should then be documented electronically between healthcare sectors to ensure correct and timely referrals, for example, where necessary, and where healthcare service users and healthcare providers, where healthcare service users and providers are more involved. So now, finally, looking at sort of some as part of this research poster presentation, as part of this poster presentation, a little bit around the discussion, and then some conclusion, and what this research poster presentation adds. So healthcare service users tend to at least in amongst the literature has been outlined that healthcare service users and healthcare professionals rely on the internet or World Wide Web to literature, to join up the evidence base, to join up information retrieved, for example, through online into medical consultations. Some of which relate in regard to laboratory investigations, and in amongst disease and sort of trends. So existing non-clinical, for example, personnel, um, for example, would require applicable applicable and appropriate and continual professional continual professional continual professional development and reallocation to work with healthcare service users if they are to become more intricately if they are to become more intricately involved in amongst healthcare services. Evidence also indicates a proportion of those in amongst specific and particular long-standing conditions who access electronic patient records who access electronic patient records access sort of can tend to access intermittently but over extended durations. The patterns and timings of use indicate strong intrigue in detailed information such as appointments, telemedicine appointments, and clinical letters. However, this does not immediately mean that healthcare service users will that healthcare service users and particularly new healthcare service users in amongst particular conditions particular long-standing conditions, for example, will know for example what certain acronyms and abbreviations are in and as part of electronic patient records. That notwithstanding, to additionally add here, listeners, that in amongst, for example, in amongst electronic patient records such as patient views, where there are acronyms, or if there are acronyms, then there tends to be a little bit of an explanation next to that acronym or that abbreviation. However, that being said, again, patients or healthcare service users also sought to gain understanding through additionally through online and through social media platforms, web portals, and through smartphone apps. Health literacy has been documented as being part of a hindrance or barrier. One investigation, a mixed methodology investigation, informed that online portals, for example, are not currently designed to present test are not designed to present laboratory tests or investigations to healthcare service users in sort of an expressive way. So now finally some conclusions. So tech is integrated into everyday lives. It is important to have online spaces in the care for those who are in amongst long-standing conditions. So, for example, healthcare service users who are increasingly using internet, smartphone and smartphone apps and voice recognition as sort of voice activated recognition sort of services. However, it must not be presumed or assumed that all healthcare service users, for example, all healthcare service users, for example, can interact with aspects of tech, online spaces, all through healthcare. On the other side, at least where literature is concerned, again, healthcare service users want healthcare professionals. Also want healthcare service users, healthcare professionals to be involved. Healthcare service and where and at the same time, a healthcare service providers, who are new to particular specialties, as well, may also not be aware of particular aspects of literacy literacy and terminologies. So and so and so for best practice to be sort of achieved, healthcare service users and healthcare professionals should be using equivalent, if not identical, language. Prospective research integrating perspectives to acknowledge sort of service users as in amongst particular conditions and with in amongst particular conditions and through investigations and through and where healthcare service provision in context of educational needs for healthcare service users, uh, needs is has been critical has been critical. The social media platform, the RPSG, encourages healthcare service and support with timely and targeted education relating to, for example, chronic kidney disease, and recommendations with a solid focus is where best practice between for example, between adult nephrology and where collaborations have been with the kidney disease and renal support group, KDAR's group for kids, the sort of pediatric young people's equivalent, and so that's to tackle and challenge healthcare inequalities, so that's to tackle and challenge health inequalities is and has been pinnacle. It is important at the same time to ensure patient healthcare service users are not forgotten, are not forgotten and do not become disenfranchised. So finally, what in regard to this research poster presentation, what does in regard to this research poster presentation from 2020 to 2021, and a look at what this work adds. So understanding informs that there is a broad ranging diversity surrounding healthcare service users going through particular and specific long-standing conditions, and an overall sort of educational pathway educational pathway amongst particular uh, con, particular conditions is required, or is required or needed, owing to where in amongst literature healthcare inefficiencies have been documented, especially in later stages, to help healthcare service users adjust, to help healthcare service users adjust, and especially where they where healthcare service users could be and can be at the risk can be at risk of being isolated. That draws this audio podcast to a close. This audio podcast, as part of a Meteor edition. This audio podcast as part of a Biome bullet. This audio podcast as part of a Lobostics Phantom, and this audio podcast as part of a Cyclone bonus, and this audio podcast as part of a Storm Lobostics production.